The main things I want you guys to understand about the arterial supply, the venous supply is the exact same. So if you learn the arterial, you'll know the venous. And that's true about everything in medicine. Now, there's always going to be a couple caveats. When you talk about the venous system of the art, there are two superficial arteries. Does anyone know what they're called? You seemed like you knew it. It's like B and C. Yeah. So you have two superficial arteries that run, two superficial veins that run across, and that's typically what we kind of go for when we're trying to do a venopuncture, right? And then at one point they kind of cross, all right? Now, here's the thing about anatomy. It's all based off of fancy, I don't know what origin, like Latin or something. It's all based off of fancy words that mean either direction or some sort of thing associated with direction. So that's a vein that kind of goes across this area. We call it the cubital fossa. Fossa, I think, means like some sort of dip or something. And then we call this area, like the arm, like cubital. And so one area is called antecubital, or your forearm. And so this here is called the antecubital fossa. Okay. Now there's a vein that goes through the middle of it, and it's called, you guys don't have to write this down. It's called the median cubital vein. That's just the name of it. Okay. Doesn't matter. Here's the heart. All right. That's creepy. No, I know her. Okay, this is not an anatomically correct heart. We don't care about what the heart looks like.
Just letting you know you can use one view.
They're cozy. Okay, so this is the heart. You guys will learn all about the anatomy of your heart, the vessels that come off of it. I don't want to confuse you guys and throw too much on it. We're going to keep it very, very simple. All right. There is going to be an aorta. It arches, it does stuff. I'm going to ignore all of that. And at some point, it's going to give an artery that comes to the arm. All right. This artery is going to run below this bone here. All right. Does anyone know what this bone's called? The clavicle. Now, if it runs below the clavicle, does anyone know what we might call it? Subclavian. Subclavicular was totally fine. We call it the subclavian artery. Okay. Now, here's where it gets really interesting. Once it crosses a specific anatomical mark, that same artery gets a new name. Okay. What's the next bone? This is a guess question. I don't expect you guys to know because it's a dumb question. But what's the first bone below the clavicle? Like if we're counting ribs, what's the first rib that comes after the clavicle? The first rib. Nice. You guys are so smart. I'm telling you, this stuff is simple. People make it seem so hard, but it's not. The first rib. All right, I'm going to use black to indicate the first rib. So when it's branching off, we're going to call it this. Does someone have a good red marker? Okay. Ooh. All right. Oh my God. All right. All right. Can everyone give a... Okay. I'm going to put these school markers away because I don't want to mix them up with your markers. Please remind me to give your markers. I promise you I will forget. This is fantastic. I'm going to take red and black right now. I love colors. Okay. So, first group. Also, guys, I suck at art, but I have like a decent picture on my iPad. This might get really ugly. So if you get, and the brachial plexus will also get really ugly. So if you guys do want, like, I guess, a more pretty picture, reach out. I'm happy to send this. Or I can send it to like one of you. And if you guys can send it to everyone, make my life a little easier. That would be great. If you guys want it. So after we pass the first rib around here. Now this artery in this section, it's named for the structure that it goes around, and it's the armpit. What's the fancy medical name for armpit? Axilla. So what's the artery called? axillary artery. You'll notice in medicine, because we spend so much time getting this degree, we like to give fancy words to stuff so that the public doesn't understand it. And so they think, oh my God, you're a doctor. That's so cool. But really, it's just the armpit artery, right? It goes in the armpit. It's not complicated. Okay, so now we have the armpit artery. It's going through. Now we're going to divide this artery into 3 parts. All right, we're going to use real fancy names. We're going to call it first part, second part, third part. All right, each of these parts is going to give off additional branches of the artery. All right, the first part's going to give 1 branch. The second part's going to give 2. Third part's going to give. Okay, and we're going to talk about the anatomical structures that separate these parts. The first anatomical structure is drawn in. It's the first rib. Okay, the second anatomical part is going to be the pectoralis minor. Okay, the pectoralis is 2 muscles, right? It's your booby muscles. Okay. Okay, I don't know if anyone taught you this. Again, this is not related to like anatomy. I hope you're not tested on it, but actually you might be. But just clinical knowledge. A breast for both the female and a male. It's made of essentially fat. It's a glorified sweat gland. Okay, that's all the boob is. Now, there is a specific plane that separates the pectoralis muscle and then the fat that comes on top of it. It's a very important distinction because people just think that the boob's made of muscle, and want to make sure you guys know that the pectoralis muscle is not the breast itself. It is beneath that, and there's a fascial layer that separates them. Okay, just so you guys know. I don't know. I didn't know that when I was a med student. I'm still a med student. When I was a first-year med student, I was very clueless, and that's okay. We learned. Okay, so we have the first part here. The second part is going to be divided by pec minor, okay? Pec minor. You can also keep a tab on it. Okay, can someone just tell me when it's 7:30? Thank you. I want to not go overtime. I have a history of going very much overtime. So I'm going to try not to do that because I want to go home and sleep. And then the third part, it's going to be teres major. Does anyone know what teres major is? It's a muscle. Awesome. Does anyone know? Yeah.
You write bigger.
Yeah. No. It's a very good point. I will write bigger. Thank you for letting me know. Okay, so now we need to figure out what first, second, and third part. Oh, wait. Shoot, there's something in between first and second rib that I don't know what it is. It's not in my note. Dang, I didn't write it down. I'm sorry, I don't know what this is, guys. There's something here. Does anyone know what divides the first and second part of the artery? Okay, I can Google search it and tell you guys later. But there's something here, okay? That tells it. Sorry about that, guys. I did not realize it wasn't in my notes. So the first part is going to give off an artery called the superior thoracic artery. All that means is that it's an artery. This area, your chest, is called your thorax. All right. This artery runs from the top and it goes down your thorax. So it starts superiorly. So we call it the superior thoracic artery. Now, I'm going to draw that here, and I'm going to call it superior thoracic artery. All right. Now, the second part is also going to give an artery that runs down the side of your thorax. Does anyone know what that's called? Lateral thoracic. All right, so we have 2 thoracic arteries. The first one comes from the first part, and it goes straight down. We call it the superior thoracic. We have another one that goes laterally. It goes on top of the serratus anterior. If you guys remember that muscle, if they taught you. I don't know if they taught you. It's not that important of a muscle, so don't stress. Now, the second part is also going to have a trunk. A trunk essentially means that it's an artery in which multiple branches come off of it. Now, this trunk, it's going to supply things to the thoracic area, but also to your shoulder. Now, your scapula has a little socket thing. Does anyone know what that? Okay, that's a trick question. It's not the socket part. Your scapula has a bony prominence called the acromion, right? You can feel your acromion here. So this artery sends things to the thorax as well as the acromion. So we're going to call it the thoracoacromion, acromial trunk. Thoracoacromial trunk. It gives off 4 arteries. One artery, as it's named, goes to the acromion. It's called the acromion artery. One artery goes, if it goes to the acromion, it probably also goes to this area here. That's your deltoid artery. It also goes towards the thorax. What's the muscle in this area? Your pec, right? So there's a pectoral artery. And the 4th artery goes towards the clavicle, the clavicular artery. Those are the 4 arteries that this trunk sets off. All right. Now, the third part here is actually pretty easy because 2 of the arteries are essentially the same exact thing. They're both going to go to the humeral head. The humerus is this bone here. They're both going to go to the humeral head. But what they're going to do is one's going to come from the front, one's going to come from the back. Now, because they're both going to go and encapsulate the humerus, we use the term circumflex. All right, kind of means circle around. One comes from the front, one comes from the back. Can you guys make up names for what it could be? Anterior circumflex. We use another term though, because what bone is it going to? Humeral, right? So anterior circumflex humeral artery. And then we have the posterior circumflex humeral artery. So really these names just describe where the bone's going or where the artery is going. So those are 2 of the branches of the third part. There's one more. It goes to the scapula. It's called the subscapular artery. So I'm going to call it subscapular. Now, I want to this is going to be more of like the anterior circulation. There's also it's a very simple circulation that goes towards the back to the scapula. So I'm also going to draw that out and show you there's 3 arteries from here that are going to go to the back. So I'm going to kind of draw them out for you. Okay, this is a terrible picture of your scapula. All right, I'm going to label things. So this is the medial side. This is the superior side. And then this is going to be lateral. Okay. The subscapular artery that we drew here, coming from the third part, is actually going to run this way. I'm going to call it subscapular. You can kind of see how it runs below the scapula. That's why we call it subscapular. Now, there's a reason why I'm emphasizing all of this. Anyone interested in vascular surgery here? Nobody? Anyone interested in radiology or interventional radiology? Nobody? What are you guys interested in? Who's interested in anything surgical? Okay. I feel like more of you guys should put your hands up. You guys are interested in internal medicine? Really? Okay, I like that answer. We'll see. You guys want to write notes all day? Come on, come on. Okay, even if you're interested in internal medicine. The reason why knowing these things are so important is because there's something called anastomoses. It's essentially where 2 arteries come together and they connect. And the reason why that's important for you internal medicine doctors, heart attack, you got to treat it as an internal medicine doctor. Oh, shoot, this was open. When one artery gets occluded, a different artery picks up more of the blood supply to redirect blood to where it needs to go. Our body has so many built-in mechanisms to kind of help prolong life. And so we're going to kind of walk through, like, if there was an occlusion in one part of this vasculature, how can the blood travel to get to the distal forearm? And kind of understanding that will give you a great sense into some of these questions we'll ask you for that too. But it'll just give you a greater appreciation of vasculature and anatomy. And if you guys just master that, whether that's for this blood supply, whether it's for head and neck blood supply, whether it's for abdominal or lower leg, any blood supply, if you guys really understand how these different collaterals can form, you guys will do phenomenally throughout all of your step exams, clinical rotations, because at the end of the day, all pathology is based off of anatomy. Now, again, this vascular anatomy is just part of it. There's a lot of different anatomy to know. But if you really understand this, like, you will become experts in vascular anatomy. And then, in my opinion, it's the coolest thing, right? You learn this anatomy to essentially be able to manipulate it in a patient to make them feel better. And when you know the rules, when you know about what's going on, you can manipulate it in any way you want, which I think is the coolest part of surgery, which is why you guys should all become surgeons. Anyways, let's talk about the other parts now that you guys know that the goal of this is to figure out how we can create anastomoses and different collaterals. Now, coming off the subclavian, right here, before all this branching and stuff, I'm going to draw another big structure. You guys don't need to know it. It's the carotid artery. When people say, ooh, what's my pulse? People check two areas. You usually check here. We'll talk about what that artery is. And people check here. This artery that I'm feeling right now in the base of my mandible, that's this artery. That's the carotid. The carotid splits into two, goes into the head. That's a later problem, right? You guys will learn about that in neuro. I did want to talk about one of the branches here. This is also a trunk. This trunk goes towards the thyroid, which is in your neck, and it goes across, it sends nerves across the neck. Another term for the neck is called cervical. Let me tell you, there's a cervix in females, and there's cervical. You have no idea how many times I've gotten confused on this. All right. So make sure you guys know this. Cervical is another word for neck. It doesn't necessarily mean cervix. Okay. Am I the only one that's gotten tripped up by that? There's no way. You guys are laughing at me like this guy's dumb. Just fair. It's fine. But it tripped me up. I wanted to share. Hopefully it doesn't trip anyone else up. So this trunk is called the thyrocervical trunk. Now it gives multiple branches. I only want to talk about two of them. The first one being the suprascapular. One of them is going to be the suprascapular. The reason why I want to talk about it is because this one is going to come supra, so from the top to the scapula. So it's literally going to run down like this, and we're going to call it suprascapular. The other one is going to go across the neck. What do we call it when something goes across? Transverse. And another fancy word for neck is cervical. So we're going to have the transverse cervical artery that runs with it too. Now, the reason why this artery is important is because it runs transversely across the neck, but then it also takes a sharp turn down posteriorly, and it runs down the medial aspect of the scapula. So we have transverse cervical. All right. Now, from the subscapular artery, you know how here, what did we call these arteries that go to the humerus?
Anterior, posterior.
Circumflex, right? Because they went around. This subscapular is also going to give a circumflex artery that's going to go towards the middle. All right. I'm going to put a little star here. And I'm going to call this, what am I calling this? Circumflex scapular. Okay. Now, there's a very specific reason why I drew all of this. Hypothetically, if someone were to, let's say, have a stroke or something that essentially full, does everyone know what a stroke is? Yeah. Okay. It's essentially when you have a full occlusion of an arterial blood vessel. There's two types. There's thrombotic and embolic. Do you guys know the difference? You don't have to. It's okay if you don't. Thrombotic is when you have that occlusion happening at that one point, usually because of like atherosclerosis or something like that. So you get a thrombotic clot. You guys did heme. Yes. Okay, good. You guys remember how that coagulation cascade, all those numbers, the benefit of that is that it masks an exponential coagulation pathway, right? When one molecule, factor 12 or whatever, is activated, it activates 10 of the factor 11. Shit. I can always keep talking about stuff and then I get distracted. Okay, I'll talk about this and then I'll focus. It activates 10 factor 11s and then it activates 10 factor 9s, right? Because we skipped 10. And then it activates 10 different factor 8s. So by the time we get to factor 8, like, it's like 10,000 factor 8s that were activated. And then you go to factor 10, and then factor 5, and then or factor 5 is a cofactor for getting to thrombin, which is factor 2. So you get this exponential growth. That's what's so scary about a thrombotic clot, because when you get like an atherosclerotic plaque that's closed off, and then when it ruptures, all of this is essentially radioactive material. And I say radioactive, like it's just super, super energetic. And all the blood that touches it starts clotting off. And then you just get a complete occlusion of that artery. That's a thrombotic clot. Embolic clot is when you have like an atherosclerotic plaque and part of it chips off and it goes. These vessels here are big. They're not that big. They're like this big in real life. But then these vessels like down here, like over here or in your brain, like super small or super tiny in diameter, when that clot goes, it's able to go through the big arteries, but then it gets to the smaller arteries and it just, like a pipe, like a clot in a pipe, it just gets stuck there. That's an embolic clot because it's going to a different location. Does that make sense? You guys will learn more about that in neuro, but I don't know. There were like a lot of things when I was studying M1, M2 year where I was like, I just never knew what it truly meant. I memorized the words so I could get it right on a test, but I didn't truly know what it means. And I feel like knowing that just makes it easier. So I'm trying to share that with you guys. It seems like you guys already all know this stuff, so that's great. Yeah, he told me. I'm very behind, but that's okay. We're almost done with artery. Once this thing crosses teres major, we use a different term for this area. We call it the brachial artery. So now this part is now super easy because it's going through the forearm. Now the unique part of the brachial artery, it splits and it gives something for the posterior compartment of the arm. All right. You guys learned this, I think, probably like week 1 of MSK, or I don't know when you would learn this. Like this is the anatomical position. We have superficial and deep. When something is deep, it means it's closer to like the internal part of your body. So if we have this brachial artery here, and then I put something posterior to that, what would we call it? The deep brachial artery. All right, so this branch here is called the deep brachial. And then this is the brachial. Now, the brachial artery continues, and then it splits into two. What are the two bones in your arm, in your forearm? Nice. So one's going to be the ulnar artery, one's going to be the radial artery. One of these arteries goes right past your thumb, right by your thumb, and we can feel it. What artery is that? Radial artery, right? Your ulnar artery is going to be on the medial side, and it's like, you got to really press for it. You can feel it, but like not really. So this one is the one. Ooh, something really interesting. You guys might have learned this in OSCE. How do you palpate for the brachial artery? Have you guys learned how to palpate for the brachial? Oh, you guys are gonna be so smart when your preceptor asks this. If you all put your hand in your forearm and you press really hard, can you find it? It's really hard to find. So what you do, you ask them to flex a little. What's the tendon that pops up automatically? Your biceps tendon, right? What's really interesting is this artery runs medial, this way, medial to that tendon. So feel for that tendon, go medial and press really hard. Anyone feel the artery? Yeah. It's a hard one to find. But if you know this distribution of where the bicep tendon goes and you go right medial to it, you're going to find it 100% of the time. All right. That's one of the reasons why I think anatomy is so cool, because if you know anatomy, you can do such cool things with it. A lot of people don't know this. So I'm sure your preceptors will teach you that in OSCE, but if they don't, you're going to teach them and it's going to be great. I'm going to teach them stuff. All right. So we have radial and ulnar, and I'm going to keep drawing this because it's very simple. The ulnar artery is going to come all the way down to your arm, and this area is called your palm. And so it's going to create a palmar arch. One of it's going to be pretty superficial. It's going to be called the superficial ulnar arch. And then the radial one is also going to come down and arch a little bit more proximally. And this one's going to be a little deeper. So it's going to be called the deep radial arch. I don't think you guys get tested on that too much, so I wouldn't stress about it. But the main part I want to emphasize here are the collaterals, and I'll talk about why they're important. This is the medial side, this is the lateral side. You guys all agree? Now, on the medial side, you're going to have arteries that run from the brachial to the ulnar. Now, coming from the brachial, you're going to have one that's going to be superior and one going to be inferior. They're coming from the brachial, so they're all going to get the term brachial. And the point of these is to serve as collaterals. So they're all going to get the name superior or inferior brachial collateral arteries. All right. And there's going to be two of them that are going to run like this. Superficial or superior, sorry, superior and inferior brachial collateral arteries. Now, oh, you guys haven't learned that yet. Does anyone know what like the laryngeal recurrent nerve is? Might have heard of it. MCATs, maybe, maybe not. Forget about it. You don't need to know what it is. Essentially, when you have something that goes backwards, we call it recurrent. Because like, we're like, dude, are you stupid? Why are you going backwards? And so it's going recurrently. Both the ulnar and radial are going to have recurrent arteries. The ulnar is going to have two, and they're going to go towards each other here and connect. And they're just called the ulnar recurrent artery. And the radial is going to have one that goes to the deep brachial. So you guys might be like, why are you teaching me this? This makes no sense. It's stupid. This is a waste of time. I want everyone to bend their elbow. And now feel for your radial pulse. Can you still feel it? Bend it, bend the elbow. Can everyone feel the radial pulse? When you bent your elbow, you just occluded the brachial artery. The brachial artery is not flowing. How are you getting blood to your radial artery? This is not flowing because you bent the elbow. You essentially kinked the brachial artery. How is it getting to your radial artery? Huh? Yeah, the recurrent arteries, right? So essentially you block this connection because you kinked it at the elbow. The deep brachial gets more blood flow, and then the superior and inferior brachial collateral arteries get more blood flow. They go to the recurrent ulnars, they go to the ulnar, and then the deep brachial goes to the radial recurrent, and it comes down here. All right? Interesting, kind of? Are you guys like, dude, doesn't matter, who cares? I respect that. The reason why you should care, this was a simple example for something that everyday life happens. What if someone clogged off their subclavian artery? Oh, you guys haven't learned about subclavian steel. You guys will learn about that in neuro. That's fine. It's about a phenomenon with the neck. But here, you clot off your subclavian. You guys learned about like hypercoagulable disorders in heme? Yeah. It's important because like when you do your internal medicine rotation, because you guys love medicine, these people are gonna work up hypercoagulable disorders like crazy. So you really need to know about like protein C, protein S, all of those different factors. If you don't care about them, do surgery. You still have to care about them because like clotting affects surgery, which sucks, but it happens, it's fine. If you clot off your subclavian, how are you gonna get blood? Are these people just gonna have their arm fall off? No. Why? Because we have a trunk here. What was it called? Goes to the thyroid and neck. Thyrocervical trunk, which gives the suprascapular artery, which is going to do a little anastomosis with the circumflex scapular and the subscapular. It'll go backwards, and all of a sudden we just shifted out all of this, and we're going back here into the subscapular artery, down through the axillary artery, into the brachial, and into the rest of the arm. Do you guys see how that happened?
Can you do that one more time?
Absolutely. Can someone get up here and do it? Who can do it? I can do it again. I know one of you guys knows how to do it. You just have to point. Come on, guys. Okay, fine. We start at the heart, right? Everyone know right heart versus left heart? I won't get into it because I'm over time. I know. It goes up. We'll talk about what this is. Aorta, whatever. You guys don't need to know. It goes through the subclavian, but there's a block here. So you guys know physics, I'm sure, right? When there's something's blocked, it goes through the other way, right? Because there's resistance here, it goes to the path of least resistance. So everything's going to go through here, through this thyrocervical trunk. Then it goes into the suprascapular artery, which we drew, goes here, from the top, supra, to the scapular. Then it goes to this artery that goes around the scapula, the circumflex scapular, which goes into this artery, which is below the scapula, subscapular. Now, normally subscapular flows this way, but here, no blood is getting here. So the subscapular has no blood, which means this is an empty tube to go in whichever direction the pressure gradient wants it to take, which means it can now go backwards, right? You guys think learned about this? Veins have valves that prevent backwards blood flow. Arteries don't. One of the coolest things about surgery is when you do vessel anastomoses, where you get to essentially use like a different vessel that's in a different part. You guys will do this like if you're, no, it's cardiac surgery, like a cabbage procedure where you use like a vein in the leg to reconstruct a vein in the heart, and they use it as an artery. It's super cool. And they strip it of the valves. But the reason they can do that is because it's just a tube. It can go in whichever direction it needs to. So it goes backwards. Backwards, it goes into the subscapular, which is in the third part of the axillary artery, armpit artery, crosses this muscle. This is an S. No one corrected me? Embarrassing. Sorry. And then it goes into the brachial and it supplies the arm. Right? Now you can make an occlusion at any point in this, and you guys should practice. Make an occlusion at any point of it and see how can you get that blood cell down here. And I challenge you, after you learn this, draw it by yourself. Go through it a couple times and then draw it by yourself. You draw it once by yourself, you're never forgetting it. I promise. Are you okay? You won't forget it for the test. All right. I promise it works. And I recognize my picture is hideous. But I think the anatomical landmarks are the key. Some of your colleagues, and maybe you will do this too, are going to spend hours in the anatomy lab before your anatomy test. I personally spent 30 minutes to an hour max. Because for me, that anatomy test was essentially my free time. Because I finished my NBME test, I was on vacation. I would go in lab for like an hour, look at stuff, help people out, show them structures, and then I would go home, do whatever I wanted. Reason being is because if you know the relationships, you don't need to go and look at every structure. Absolutely, do it if you want to, but you don't need to see every single structure to know what it looks like. You need to be able to say, if there's an artery that crosses teres major, it has to be the axillary artery becoming the brachial. You can close your eyes and do that. If you see that there is an artery and I see the first rib and some structure that I don't know the name of, and I see that there's one artery going down, it has to be the superior thoracic artery. There's no other artery that comes in, right? I know that if I'm between the pectoralis minor and teres major, I see those two anatomical landmarks, and I see 3 arteries. I know 2 of them that are going in the same direction are the circumflex humeral arteries, and I know the one that's not going in the same direction is the subscapular. Automatically. I don't need to look at anything else. I just need to identify my landmarks, and I know what are the structures. We'll talk about that for nerves as well. But this is, at least this is my methodology. This is the way I've done it. You absolutely don't have to do this. If you feel comfortable going and seeing every single structure on every single body, you are welcome to do that as well. I liked watching Netflix. Up to you. Okay, any questions on arterial supply? Yeah.
What direction is subscapular going in?
Sorry, what?
What direction is subscapular going in?
It's actually going posteriorly. So your artery supplies are running like this. Does everyone have access to the Netter's textbook? Search it up online, get it for free. Run through those pictures. Those are beautiful pictures, and look at the relationships. Don't memorize these are the different structures and look at it for every single thing. Look for relationships. How does this artery relate to the muscle? How does it relate to the bone? Does it go anterior? Does it go posterior? Those are the things you want to really focus on. And so here, as you mentioned, the artery runs like this. The subscapular artery actually goes backwards because the scapula is in the back. So it's going to run backwards. And there's pictures in Netters. And I have slides that are like labeled and it shows the relationships. So if anyone wants those slides, feel free to text me. I'm happy to share them. Any questions on arterial supply?